End-of-life care should be prioritised by the Welsh Government, according to a charity working with people who have terminal conditions. Hospice UK says a quarter of those that need palliative care in Wales are missing out on the support that they need, and that demand is set to rise. Gary Owen reports.
Lindsay Wheeler is visiting the Hospice of the Valleys, Ebbw Vale, to meet up with some of the staff who've helped her deal with the death of her mother Anne from bowel cancer.
I felt very anxious about it because it's all very unknown, and I was afraid to ask questions because I'd be afraid of the answers, but the medical professions couldn't give you the answer because it is unknown, because treatment works in different ways for different people and doesn't work for some people at all.
Since then, she's received bereavement support from the hospice and has set up a group of people to share similar experiences. Hospice UK, a charity working with people affected by or facing death and bereavement, say voices such as Lindsay's need to be heard as the Welsh Government prepares a new programme to deal with end-of-life care.
We really welcome the commitment from the Welsh Government to bring forward a national programme for end-of-life care. That is one way of prioritising this area, but what we want to see now is a few details and plans and actions around in that to drive it forward. As a priority, we'd like to see that national programme tackle the biggest challenge that's ahead of us, which is the increasing need for palliative and end-of-life care.
A spokesperson for the Welsh Government said they continue to invest more than £8.4 million every year to support specialist palliative care services, and also allocated over £12 million of emergency funding to hospices during the pandemic.
Hospices provide support for patients with life-limiting or terminal illnesses like cancer, motor neuron or dementia. This hospice alone in Cardiff, the City Hospice, has provided support for 550 patients at any one given time and has worked throughout the pandemic.
Doctors working in palliative care say it's vital that patients are aware of the options they have and talk about what they'd like to see happen.
If you're willing to discuss or open to discussions around end-of-life care, although they can be very daunting as conversations, and actually we're far more likely to be able to honour your wishes, and it means that, for example, if you wanted to die at home, you're far more likely to die at home.
In Ebbw Vale, Lindsay is now helping others from her own experience. How important is talking?
I find it very important. It's really helped me, but I understand it's not for everyone and it doesn't help everyone.
Hospices say that lessons learnt in the pandemic about cancer care now need to lead to longer-term change so that people can have the best experience of quality palliative and end-of-life care.